Good morning, ladies and gentlemen, and welcome to the Portland School District Podcast. This is the second one of this new year, and with us our able leader, Dr. Charles Britton, our Superintendent of Schools, and our very, very special guest from the Chatham Health District, who's a little bit tired today from the COVID clinic last night, Russ Melmed from the Chatham Health District. So welcome, guys. Thanks for coming on. And Russ, I know you've been running around like you're a chicken with a head cut off here for the last running these things. So, but anyway,
yeah, it's intense. Let's just say that it's an intense experience.
All right, Charles, what do we got for our second podcast for this year, and where we are? I think we're back hybrid, so lay it on us.
Yeah, well, we reopened this week fully pre-K through 6, and we're in the hybrid now, grades 7 through 12. So the good news is that we were able to generate the pool of substitute teachers that we needed. The last time we got, really, as everybody knows, knocked right on our butt.
Right.
As a function of the large numbers of adults who were subject to these quarantine periods. Mm-hmm. And we needed to hit pause so that we could generate a new pool of subs that was made available by two things. One, Governor Lamont's order that waived the requirement that substitute teachers have to hold a bachelor's degree. And two, a incredible outpouring of community members saying, hey, I'm willing to help. I can step forward. And a lot of these individuals, it works out really nicely, are current college students who haven't gotten their bachelor's degree yet, but are studying to be teachers. So what a wonderful opportunity for them to prepare for their career and make a couple bucks on the side while taking most of their classes, because lots of universities are still online.
Sure, just like student teaching.
Just like student teaching, right? It's a built-in internship for them, right?
Exactly.
So because of that change in the requirement and the remarkable outpouring, we now have an additional 15 to 20 individuals who are on call, and we already need them. This week we have had 2 instances where COVID positive individuals entered the school, and currently have students and members of our faculty who are subject to a 10-day, and Russ can talk to you about how that changed, quarantine period. But now we have people to call to come in and help staff the buildings.
Fill the ranks,
right? So it's going well. The numbers are still high. There's still a lot of virus in the community, but we're prepared now to take on those quarantine periods when they come. And we're going to try. We're going to do everything we can to continue to maintain the in-person learning while staffing the buildings. A decision about a return to full in-person at the middle school and high school is still pending. What makes the middle school and high school different is that we're not able to cohort as well, and therefore, one student has the potential, if they are either asymptomatic or pre-symptomatic, of causing quarantines for larger numbers of students and faculty. So we're going to have to see how this plays out a little bit. And I think Russ, maybe if you could give us now an update on transmission rates in the community, and I hope what we're seeing is we're either at the peak and now on the downturn of the curve. That's what we need in order to really move back to as close to normal as we can get.
Sure. I think one of the big things now that the vaccine is on the scene, that's going to help tremendously. As far as that goes, not only medically, but I think it's going to be do things mentally for a lot of our residents and so forth. So I don't know. Russ, you want to jump in? And I know you had a very, very successful vaccine clinic last night, so it's all you.
Sure. So I guess to borrow a football metaphor, some people say that the best defense is a good offense. And I think that's probably true with regards to the vaccine. That's on the scene now, and we get to play a little bit of offense now. And last night we held our first mass vaccination clinic at the Portland Middle School High School complex, and I think by any measure, it was a tremendous success. In about 5 hours, we administered 200 doses of the Moderna vaccine. The vast majority of the people who came to the clinic were our oldest and most frail residents. So that was really the goal here. The state shifted gears on us abruptly last week. We were sort of moving in the direction of vaccinating frontline essential workers, teachers, people in transportation, and they shifted a little bit and said, no, none of those groups now. We're focusing on people 75 plus. So we did that. I just thank you to Charles for the use of the building and your staff. The only way we succeed in doing anything like what we did last night was with good planning, good partners, good staff, good volunteers. And so it all came together very, very well last night. We just had, overwhelming attendance, and we got a lot of good, positive feedback on how things ran. So it was really great. I don't know how many more 15-hour days I can handle. Can we do this for the next 12 months? I think we'll start planning more clinics during daytime hours, weekend daytime hours, and things like that, so that it's just a little bit easier on everybody. But it really was great. It was really great to, like I said, play a little offense in this pandemic.
I think he's just going to have to schedule an afternoon nap, Russ. That's all.
Yeah. I think that's it's got to be built in for sure. Maybe we need a nap room, a soundproof chamber. Charles, you have one of those in that fantastic building of yours?
Yep.
Like a sensory deprivation chamber where we can send our volunteers to take a little break and get away from the mayhem.
For sure.
Be great. So, in terms of where we are with the pandemic, besides being able to play offense with vaccine, we're in a pretty bad place, but as Charles mentioned, he's hoping that maybe we're at a peak. It seems like perhaps we're there. It would be in keeping with all the models that were projecting a peak during this second wave around this time, mid-January. So we really did see a pretty big surge following Christmas, and that was not inevitable, but certainly expected. And in Portland, we're at the case rate is 62 cases per 100,000, which is a little bit down from where it was this time last week. So it does seem to be peaking. It's a little bit too early to say for sure. I mean, we've seen bumps in the curve, and then we've seen surges come after the bumps, but those surges after the little dips happen after, around the holidays. So we had a holiday where a lot of people were not getting tested. We saw those dips, and then after the holiday saw a surge. We saw it happen after Thanksgiving. We saw it happen after Christmas and New Year's. And so I'm hoping that the dip we're seeing now is not a dip because people aren't getting tested, but it's really a flattening of the curve and a little bit of a dip because we're peaking. But there's still a lot of COVID-19 out there. So we really, the peak is not a good thing. We're in a bad place. So people really need to continue doing all the things that we're recommending, social distancing, wearing masks, getting tested. If you feel even mildly ill, staying home. Don't go to work. Don't go to school. We really need to do all these things. And if there's a cloud on the horizon, it's this new variant that started circulating in Connecticut and elsewhere in the United States, what people are calling the UK variant, but what is technically called the B117 strain of the virus. And unfortunately for us, it's about twice as transmissible, which means it just binds better for whatever reason to our cells. So given the same, it takes a lower infectious dose to get somebody sick, which is unfortunate because when something is twice as transmissible, we would expect to see twice as many cases, then twice as many hospitalizations, and ultimately, more fatalities. So what that means is we really have to adhere to all these things we've been doing, even more strictly. Wear a mask. Don't take it off. Don't be casual around your friends and family. Those small social gatherings is where we're seeing transmission. Please, avoid those things until we can get past this peak, until we can get more people vaccinated. We could probably have a pretty nice late spring and summer if we do all those things. But this new variant really it's expected to be the predominant variant circulating in the United States and probably in Connecticut by the end of March. So that's sort of the cloud on the horizon. But it doesn't mean that we can't continue to see gains in reducing transmission rates. We just need to keep doing the things we've been doing.
Sure.
And we'll get there and get your vaccine when you're eligible.
Right, right. Now, I know we did a testing clinic down at the Library Senior Center on Wednesday. Now, is the testing able to discern the new strains at all?
Yes, that's what we understand, is that the testing is that the genetic marker that the PCR test in particular, look for, do still pick up the new strains. So that's the good news. The testing will work. It looks like the vaccines will work against the new strains that are circulating. So all good news. And we have testing capacity. That testing clinic was scheduled to take between 200 and 300 people in Portland, and I think we only tested about 50. So that may be just because the CHC main drive-through clinic is right across the river from Portland, and
Sure.
I think people are starting to understand in town where they can go at any time, and it is literally right across the river. So we didn't get a lot of people tested. So, there's excess testing capacity. That's great. So don't hesitate. You can get a test. When you want a test, you can get a test. And if you're a little bit sick, somebody in your family's not feeling well, there's no reason not to get tested. There's a lot of convenient places to go. CHC runs their clinics in Middletown at 19 Grand Street from 8:30 to 4 o'clock every day of the week, Monday through Sunday.
Right.
So you need to get tested, you can get tested.
Well, it worked out well because I went down and helped set up for the clinic, and I felt bad, so I got tested again. So that worked out very, very well.
Yeah, and if I could just
Why not?
add
Fair.
in too, Russ. What in terms of this new variant and the old variant, I think, and Russ, correct me if I'm wrong, that in terms of the old variant, the non-mutant one, we still aren't seeing widespread transmission in schools. That the mitigation strategies against the old variant, with what we've done with cohorting and social distancing and mask wearing and cleaning and all of the, my goodness, things we've done, it is still the case, and Russ can chime in, that statewide and in Portland, we haven't seen outbreaks in schools, transmission in the classroom, which is a good thing.
Yeah.
It does, of course, though, with this new variant, which is more transmissible, put us on even greater defense. Right? I like the offense-defense analogy, but it means that we have to continue to be really careful, double down on those strategies, and pay attention to Russ and the State Department of Public Health's ongoing research and monitoring epidemiologically, of whether it's being transmitted in schools. Because if that starts to happen, that could cause us to change course here. Russ, did I say that correctly?
Yes. You're right. We're not seeing a lot of transmission in schools. So when a person comes into a school and ultimately we identify them as being infected and infectious with COVID-19, we really rarely see transmission from that person to another person in the school. When we have seen it, it's been rare. It's been to one person. So, one person to another person, not one student or one teacher and a big cluster of 6 or 7 people in the same classroom get sick. We really have not seen that. When we've seen transmission, it's been one person to one other person. I don't want to say that that's okay, but it is limited. Really is. When you look at where transmission's happening, schools seem to not be those places because everybody is staying in their place, trying to keep their distance, wearing their mask all the time. The HVAC system seems to be functioning, well. Cleaning and disinfection seems to be functioning well. And I think a lot of families are heeding the advice to not send their kids home when they're sick. Most of the cases that I see lately, the students are home when they find out they're sick. They find out that they're around a family member who tested positive. They stay home, so they are observing quarantine. They get tested. They find out they're sick. They report it to the school, but they haven't been in school. We're seeing a lot of that right now. So that's the good thing. I mean, people are not sending their kids to school when they find out that they were around somebody with COVID-19. That's the best way to prevent any transmission in schools, is to never send the kids there when they find out they were around somebody in their social circle or family circle who had COVID-19. Stay home. That's how quarantine works. If you stay home, then you're not going to get the opportunity to be in a place like school or to be in your workplace to spread it around to others. So it seems to be working. But yes, that new variant, all we know is if something is, transmission in schools is a rare event, okay? But when something is more transmissible, the rare event will just be less rare. So given all the same circumstances and all the same mitigation strategies in place, the rare event will be less rare. And so if we start to see things happen in schools that we weren't seeing before, transmission occurring more often, if we start to see clusters, one person comes into school and 5 classmates get sick, we're going to have to make some tough decisions because that's the kind of thing we don't want to see, right?
Right.
And so we'll see how well our mitigation strategies work. We really have to double down on them. We really takes everybody understanding their role in the chain of transmission. If you live with somebody or you're around somebody who find out had COVID-19, don't come to work or school. Observe quarantine, get tested, even if you feel well.
Great. Russ, on the vaccines, have you noticed what's the status of the supply chain on the vaccines?
It's poor but improving.
Okay.
The state of Connecticut. So the state of Connecticut gets around 46,000 doses a week. Half of that is Pfizer, half of that is Moderna. Next week's allotment is going to be a little bit different. It's going to be more Pfizer, less Moderna. Unfortunately for us at a local health department level, we can only handle the Moderna vaccine because it can be kept at normal freezing temperatures or even refrigerated. The Pfizer vaccine has to be kept at between minus 70 and minus 90 degrees Celsius. We don't have that capacity in our health department, and most providers don't. So that really goes to the large hospital systems. So if you think about just talking about Chatham Health District, so if there's 23,000 doses of Moderna vaccine, Chatham Health District is around 1.7% of the population of the state of Connecticut, okay? We have 63,000 people out of a population of 3.565 million. That's 1.7%. Our allocation just on a per capita basis of the Moderna vaccine would be 390 doses. And Chatham Health District, as a health department, doesn't get the entire allocation for our population, right? So what we're talking about is tiny numbers of doses of vaccine allocated for our entire population. If you just want to think about Portland being roughly 1/6, of that, 1/6 of 391 doses is not a lot, right? It's like 65 doses.
Sure.
So just on a population basis, I just want to break down the numbers. That's what we're getting.
Right.
It's not a lot.
Right. Now, last night's clinic, obviously, there were people from outside Chatham Health, correct, that were able to come?
Yeah, so anybody in VAMS, which is the Vaccine Administration Management System, that's the system that the state is using mostly for tracking doses and scheduling appointments. Once you're in that system, you can get appointments anywhere. It's just like our residents, if they're in VAMS, can go to UCFS in Norwich, or they can go to the Middletown Health Department's clinics, or they can go anywhere. So, too, can anybody in the state come to our clinics. Now, looking at the town of residents for the people who came to our clinic, most of them were local, and many were hyper-local. So many were from Chatham Health District or some from the surrounding towns. So we didn't get people from far and wide. We did get mostly people from the district and some from, surrounding towns, Middletown, Glastonbury and things like that. But mostly they were from the district. So that's good news that people are coming to our clinics from our district. But we have to think of this on a population level, right? If we start, for example, hoarding vaccine for just our people and everybody else does the same, we sort of dismiss the idea that we're all interconnected. So I like the idea of VAMS sort of being able to open up appointments to everybody from wherever they are, because I wouldn't want to think that our residents would be restricted to clinics, only in our area. If they want to go to a clinic across the river in Middletown, go.
Right.
If they work in a place like, let's say they work in Bristol, but they live in East Hampton, I wouldn't want to think that they can't go to a clinic, that's near work because it's more convenient. So
Sure.
If this pandemic has taught us one thing, it's how interconnected we all are. So getting people from all over for our clinics, I am totally fine with that.
That's great.
Yeah, can I jump into that too? And Russ, maybe just to get you to comment on one thing in terms of people waiting in line, right? The way at this point in the pandemic, I don't think I know anybody now who doesn't know somebody personally who it had or has COVID. I mean, I know dozens of people at this point who've had it. Fortunately, the vast majority, 95% of those people had it and got sick for a little while and recovered, are back at work and seem okay. And I do know a couple that had some underlying conditions that are still struggling. But from what I'm hearing, that the folks who largely are ending up getting very sick and in the hospital are older populations, are 75 and older and 65 and older. And therefore, Russ, correct me if I'm wrong. I think it would be important for us to prioritize those individuals so that our hospitals aren't inundated with sick people. So, I think it's important for us to wait in line and let the people who are at greater risk go first and be patient with this, right? I mean, Russ, would that be an accurate statement?
I agree with that. There's two factors I think that went into the decision to prioritize older adults. And you can have an ethical discussion about whether it's right to prioritize the people who are most likely to suffer the worst outcomes versus prioritizing the people who are perpetuating the pandemic, principally younger working age adults, right? Those are the ones who are perpetuating the pandemic, driving the case numbers and making it more risky for everybody. But the people who are at highest risk, they can stay home, yes, but they also are at highest risk for bad outcomes. So you can have an ethical discussion about that. So that's one of those things that I think the tiebreaker ended up being, how do we protect our healthcare system? So if you remember back in March and April, we were maxed out in terms of our hospital ICU beds. I mean, we were not in a good place. And so the concern is, how do we protect that system? And I think that really was the tiebreaker. The way we protect that system is by reducing the demand on that system by vaccinating the most vulnerable and the people who are most likely to end up hospitalized. And I know it's not what people really want to hear. Some people say, well, I'm more likely to get it because I have to work, and that is true. But I really do see that protecting our hospital capacity being one of those important factors.
Yeah, and I the bioethical discussions about this are I'm sure ongoing and going to frame a lot of, college classroom discussions in the future. But for me, God forbid, I have a car accident going home tonight. I want there to be a hospital capacity to take care of me. So I see the wisdom in that.
Yeah. Oh yeah. For sure. Great, Russ. I appreciate it, and thanks for coming on. I know you got to go you have a 9:30 meeting and so forth, but I don't know if you just want to touch base on last night. Obviously, there's an app that was on the cards or on the literature that you were handing out. I don't know if you want to just touch base on that just a little bit.
Yeah. So VSafe. We encourage everybody who gets a vaccine to enroll in VSafe. It is the way it will, check in with you if you've got a smartphone. It will send you text messages every day for about a week, and then weekly for a little while after that, asking you about any kind of side effects you might have had from the vaccine, how you're feeling. We can think of it's important because this is the way we will start to understand on a much bigger level what the side effects are of the vaccine, if any. Who experiences those side effects, to what degree. Because you can think of this rollout of the vaccine as something of a phase 4 clinical trial, right? Phase 3 clinical trials are done. They're evaluated by the FDA for safety and efficacy of the vaccine. They're done with tens of thousands of people, but the experience of 10 million people or 100 million people, you might identify some more extremely rare, adverse reactions, for example, when you give it to 10 million people that you didn't see in 40,000. So it's not meant to scare anybody. This happens with every single drug that is used. Every single one has this phase 4 clinical trial aspect to it where the FDA wants to gather more information. Now we have the technology. We can leverage the technology through smartphones and texting to gather that information. So VSafe, everybody who gets a vaccine gets a VSafe flyer. They can scan a QR code and enroll in VSafe. It's very quick. You get these text messages, and you just answer a couple questions every day for about a week. It really is great. I think it's better than what we've done in the past with other rollouts of vaccines and medications, where the FDA said, here's the number to call, if something happens. right? Call this number. Well, that didn't work that great. So I
Right.
think leveraging technology enables us to understand who's having reactions and balance that against who isn't having reactions. The old phone number style, it was call if something's going wrong. You only know about the people who had something go wrong.
Right.
So now we can get information on everybody, which is great.
Great. Well, I appreciate it, Russ. All right. Thanks so much, Russ. I'll let you go to your 9:30 meeting and go from there, and we'll throw it back in Charles's court here and go from there. But thanks for coming on, Russ. I appreciate it. And
Oops, that I'm hanging up. Thanks, Russ.
all righty.
He's a busy guy. these
Yes, he
days.
is.
My goodness.
Yes, he is. Well, while you're still here, Charles, I think why don't you just give everybody up a date on the CIAC, determinations and so forth.
Yep. So, as everybody's likely aware, the all interscholastic and town club-based sports, youth leagues or whatever, were paused by executive order until January 19th. The decision was made by the Department of Public Health that after January 19th, we could phase in a return to winter sports with lots of conditions, lots of mitigation planning and things in place, right? So there are classifications of sports, and they make sense. There are sports like rugby and wrestling and competitive cheer and martial arts where in a non-pandemic world, those involve certainly you're inside of 6 feet and likely to if you have a virus, spread it, right? I mean,
Right.
you kind of just think of those sports conceptually, and they're more dangerous than, say, golf or tennis, right? So for the winter sports, the high-risk sports of competitive cheerleading and wrestling, those aren't going to happen in a normal way. Conditioning, opportunities to work out are allowed, but we're not having a wrestling match this year. It's
Correct.
just not going to happen for pretty obvious reasons. Lots of viruses could be exchanged on a wrestling mat. Other sports that are considered moderate risk, in our case, that's basketball and indoor track. Again, we can return to those with mitigation strategies like wearing masks and sanitizing and as much as possible social distancing. So we're going to follow very closely the recommendations from the Department of Public Health and move back in the direction of those sports starting this week and next week. And from what I'm hearing is it's a shortened season, but we would be able to return to some competition on February 1st. Right now, we're going to carefully monitor this. Our nurses, our coaches, our athletic coordinators are going to watch this carefully, and we of course will make sure that all of the mitigation strategies are comprehensively implemented. But we're gonna tiptoe our way back into a winter sports season.
Great. I think the students will be welcoming that.
Of course. Yep.
As far as that goes. So, that's great. Now, because we're just finishing up the first semester now. Second semester starts in
February 1st.
February 1st. Okay, so 2 weeks.
Right.
About. All right, so all set. All right. I think that about covers it, unless you have any other issues that you want to touch base on, and we'll.
I don't. There are lots of other things going on related to ongoing budget preparations and schedules and things for next
yes.
year. So maybe our next podcast we can talk about things not related to COVID. I'd love to come back to discussing, teaching and learning and other great things that are happening. COVID has certainly sucked a lot of the oxygen out of the conversations these days, but other great things are happening too. And maybe our next podcast we can talk
Yes.
about things that aren't virus related.
Yes,
That will be
yes.
a welcome relief.
Yes, the budget season is upon us, so to go from there. All right, Dr. Charles Britton, thanks so much. This is our episode number 10 of our Portland School District podcast. I'm your host, Dave Kuzminski, and with us today, joining us on our podcast today was our Chatham Health Director, Dr. Russ Melmed. So until next time, thanks so much, and please, as I always say, Stay home, stay safe, wash your hands, and above all, wear your mask. So we'll see you soon. Thanks. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.